This is a podcast about our lived experience, which unfortunately includes infant death and subsequent mental health struggles. Please take good care of yourself and only listen if this content feels safe for you right now. We'll still be here when you're ready.
Hi, I'm Judith.
And I'm Melina. We are internet friends turned real-life friends who both experienced the tragic loss of our sons to sudden infant death syndrome in winter of 2021.
In the year after Aiden died, my husband and I both became unemployed. My parents divorced, and we had to move 5 times for various reasons.
And as for me, just a few weeks before my son Quinn died, my then husband had come out to me as a transgender woman and were subsequently divorcing.
It's been a lot.
It's been a lot.
But as long as we're living, we will love our sons deeply and work to make sure that we live a life that makes them proud.
Welcome to As Long As I'm Living podcast.
We're so glad you're here.
Okay, well, let's get started. Dr. Arling, it is a pleasure to introduce you to my friend Alina. Alina, this is Dr. Arling. Alina knows all about you because we actually recorded an episode of this podcast the day I had a panic attack on your floor. So
our meet cute.
So our audience is familiar with you. Well, that actually I guess is a good segue. I'll introduce you just to say that you are a pediatrician and that you work as a pediatrician in the suburbs of Washington, D.C., or like right in Washington, D.C. And I will say that you are also a lost mother yourself. So I want to give you the opportunity to introduce yourself and your family in any way that you like.
Sure. Yeah. So I was thinking about this. So I'm Laura Arling. I've been a pediatrician for almost 15 years now, I guess 13. And I was a pediatrician before I became a mom. And I think that one of the biggest life journeys I've been through has been sort of the evolution of not only my personal life, but my professional life through motherhood. I have 3 beautiful children who have all given me very different things, but our first child, Remy, was born on Christmas, almost 6 years ago now. And everything was supposed to be perfect. And then my water broke early. And then I spent 4 weeks on bed rest, and everybody told me that was going to be the worst 4 weeks of my life. And they were very, very, very wrong. And he was in the NICU and looked beautiful and came home for 8 days and was beautiful. And then had like a weird, like choking event that we thought we just, got RSV or had some sort of bad luck. And then we never went home. And we were in the cardiac intensive care unit for 7 months because it actually ended up that he had a very rare, they call it a congenital heart defect, but it's that a blood vessel from his heart wrapped around his airway. So he couldn't breathe on his own. So so ended up needing a lot of procedures and would not have lived past 1 month of life had it not been for the absolutely amazing medical care that we received, that we're lucky enough to live in one of the few places in the country where that was easily available. So there were a few hundred times where we could have had a shorter journey than we did. And we're so blessed to have every day that we had. But then he passed away in August of 2017. And that's really when this new journey for me began as kind of a bereaved mother, as a heart warrior mommy, and as a new type of pediatrician, because I now understood the worst thing that a parent would ever have to go through. And that sort of, I saw behind the curtain. And, I think it changed my whole professional life in a very positive way, actually. So that's part of why I'm here tonight, kind of sharing my story and having a conversation with you all, because I value everything that Remy brought to my life now and has continued to.
And you subsequently have had 2 living children.
That's right. Yep. So I have Henry, who's now 3, and Astrid, who's 18 months old. And we joke that Astrid is sort of the unknown blessing, because we only ever planned to have 2 children. And after a very difficult mental health journey for myself before being ready and capable of having Henry. And I don't think I was ready to have Henry when my husband really needed something to love.
Judith, you relate to that, right? In your marriage.
What do you mean? My pregnancy was just great. It was a dream. I ended up on no one's floor. I was great. I was so normal. I wasn't on medication the entire time. I didn't lose my shit. I was great. But part of I would say, like, when I moved here, I moved from Los Angeles, and I had to build a team of people who were going to somehow help me function, live, not, whether that's psychiatrist, therapist, whatever it is for myself, acupuncturist, whatever I did, OBG, whatever it is I needed. And one of the things I needed was a pediatrician. And I knew that the pediatrician that I had for my daughter would have to be someone who would understand that I wasn't normal, and that I wasn't a normal parent, and that that I'll maybe act in ways that from the outside make no sense and are irrational, but to someone who's lost a child are perfectly rational. And so I went on this hunt to find a doctor for my daughter that would also be a doctor for me. And I was really grateful because I found Dr. Arling. And what we really want to talk about today is the work that you've done since Remy's passing, and how I know I am not the only lost parent that you've ever helped. And you've seen their subsequent children. You've also shared with me that you've seen people who maybe one child in their family has some sort of illness or long-term health illness. And then you see the siblings of that child. So in my head, you're kind of like the rainbow baby doctor. You see all these families that are unique in that they're recovering from either they're dealing with subsequent health concerns, meaning I was concerned for my daughter's heart or her head, a million different things I was worried about related to SIDS, but also I'm severely traumatized. And you've had to help me navigate what it's like to be a traumatized parent, not just, not an anxious parent, a traumatized parent.
Judith, how did you find Dr. Arling?
Oh, okay. I'll tell you how. Because my sister is a pediatrician also. And she promised me that she would help me find a doctor for my daughter. And so she posted, I think, we don't know this, us normal non-doctor people, but there are these pediatrician mom groups. I think it was something like that.
That's what it's called.
Yeah, pediatrician mom group on Facebook. Yeah. And I think they talk about things like, how do you volunteer with PTA and be a doctor? I think they do things like that. And then I think they also ask each other questions about patients. I'm not 100% sure because I'm just a normal person, not a superhero doctor. But there are Facebooks like this. And my sister posted on there and she said something like, my sister's moving to the DC area and she needs a doctor. I think I told her to use the words, a trauma-informed doctor. I'm pretty sure I told her to use those words. Mm-hmm. And then Dr. Arling responded and said, this is my specialty. I've got a niche in traumatized patients. So you volunteered yourself.
Yeah. Well, so yes, I saw a couple friends of mine put my name on on the message. And then I was like, well, yes. So let me actually respond myself, because the urogynecologist who recommended me because I see children is correct, but that might not seem like the most clued in reference.
And you were the only
so then I responded
that you were the only one. You have a real niche. You really dominate the market.
Woohoo! I guess it's great because I really value it. So it's one of the not easiest pieces of what I do, but definitely highest value pieces. I come home at the end of those days feeling like, all right, I am emotionally spent, but I think I really helped.
Yeah. Really helped.
Whereas 17 strep tests doesn't always make me feel like the best doctor some days. So, yeah. So I'm okay with cornering the market.
Well, I don't have any living children, but when I do, I will be reaching out to you. Do you know anybody in Boston, the Boston area, who's a bereaved parent?
Yeah. Yeah. So that's sort of the problem
Okay,
is there's sort of, there's a group, there's a pediatric
Is there a
moms
pediatrician
group.
law
There's
mom group?
there's definitely, there's subsets within PMG of like, you know, these, but it's a much smaller group.
my
So I'll have to
gosh.
figure out who's in the area. So
Are we, this is like, now I'm just being selfish, but are we desirable patients for people like in your
Yeah, what do
group?
other
Or are we like,
doctors
oh my
think
God,
about
no, like
us?
I can't have too many of them. They're exhausting.
Because I feel like first of all, the morning that Aiden died, his pediatrician called me. And I think that woman, A, is scarred for life, and B, I think that she had absolutely no idea what to do or say.
Same with Quinn's pediatrician. Like she was a lovely person, a great doctor. We loved her, but like she had no idea what to do. She was new. She had just graduated. She was like 2 years into her working as a doctor. She like was completely beside herself.
And also, I mean, my sister is a pediatrician, like I've said, but like she had asked in our practice, no one had ever dealt with a SIDS case. And she didn't know what to do. Like no one, it's not even just SIDS case. None of her patients have died. Like the idea of like children dying, I mean, maybe when she was a hospital, when she was a resident, but I guess in typical pediatrician practices, babies, children don't really die. I've been told.
Yeah, but certainly not very often unexpectedly, right? Like there's like that poor kid you knew with leukemia who sort of, fought a big battle. And then on some level, it's like, okay, we're really sorry, but they really,
maybe you know what to say.
Yeah. More. Yeah. You have time to prepare what to say. Cause I also think people inherently, when they get caught off guard, are just the worst at putting their foot in their mouth, even when they're trying. Sometimes they don't try and sometimes they do try. And I can't say that either feels good at the end of a conversation. So,
Anyway, I can imagine that we are an exhausting bunch, but what considerations do you take into account when you are the pediatrician to a family that is traumatized by loss? So the child that is born after loss, obviously there are special considerations there. The parents who have gone through the worst thing that anybody can ever imagine. How do you approach that type of care, and how does it differ from taking care of like a normal family? I'm using air quotes because there are no normal families, but you know what I mean.
Yes. So I thought about this, and what's sort of interesting is I think one of the biggest pieces is trying to figure out how the family is each dealing with their loss individually and then as a group, because you're about to bring, most of the time I'm not becoming involved until there's another child, unless it was that, they had other children beforehand. So I was already involved, though I do have patients in the practice that saw other pediatricians and then had a loss and then decided that they wanted to jump on ship with me, for their rainbow journey. But for the most part, when I'm first getting to know someone, they have to share their trauma and their experience with me that first visit for me to sort of understand where they're at. And the most important thing for me is for them to feel supported individually, for me to make sure everybody is in the best place they can be for the moment psychologically.
So when Judith arrived for that first intake session and you walked into the room and she was on the floor, was that
the first thing I did was sat on the floor?
She got on the floor.
Yeah. I sat on the floor and we talked on the floor. So
how did that feel, Judith, as the recipient of that kind of care from a doctor?
I can't tell you how comforting it was that she didn't say like, get up, like, let's talk up here. Like she got that I needed to be on the floor, and the floor felt good. I'm sure it was dirty, but it was reassuring and it felt safe and familiar. And I needed to be on the floor. And if I could have gotten up and had that conversation standing like a normal person, I would have, but that's not where I was or what I was or how I could have done it. And to have someone see me for exactly where I was in that particular moment and be able to be compassionate, but also like really smart and educated was like it was the best thing I could have asked for. It was like a blessing. Mm-hmm. Yeah. It was really a blessing for me. But one of the things, I mean, we spoke about a lot of things in that first meeting, but one of the things that we spoke about was we didn't have like a clear, we knew he died of SIDS, but it wasn't like 100% clear.
And it still isn't.
It still isn't what kind of SIDS he had. And I basically said to you, like, I want to do every single test that there is humanly out there. Like, should I be doing this? I think as parents of children after loss, there are a lot of times where what I want is not medical guidance. Like, it's not like standard practical pediatrician guidance. I'm asking for things that you would never give a normal baby. So how do you handle things that are not following, whatever, what is that? AAP, I think it's called.
There's American Academy of Pediatrics is sort of a big guideline. There's Bright Futures, which is sort of the more developmental screen. So there's definitely a lot of structure and education. We all are taught the same things. Why you're coming to me is because I can meet you on your level, right? And because everybody's level is different. And then depending on where that level is, how kind of deep you are in your grief, in your guilt, in your sort of adjusting to your new normal, I have to help bring you up to the surface, to where you feel like you can make these day-to-day parenting decisions that feel overwhelming, but are just, putting your baby to bed at night and trusting that your baby will wake up in the morning. It's something that's just inherent for so many parents. And so the way I think about it is what is medically indicated, first, what would I be doing anyway? But then it's what things can I do that are the least intrusive to the baby's care that can bring you support, right? So if it's, and this happens outside of sort of the trauma parent, if a parent is really, really worried about, a child's hearing, even though my tests are showing that it's normal, we might send them to ENT for sort of a formal hearing assessment, something, or if they have an eye irritation that, and they're really worried that their baby's going to go blind. I'm like, well, giving them eye drops is a lot less important than them not going blind, right? So if it's innocuous to the baby or child, sometimes their baby is 22. That's when I make you leave. Though I have a 24-year-old right now who's refusing to leave. It's a lot of it becomes what is within reasonable, and what it is just as important for every parent for us to rule out the most dangerous things as it is to figure out what's going on. So all the time I tell my parents, I am juggling two lists in my head this whole conversation. What is most dangerous and what is most likely? And I can guarantee before you leave that I will address everything that's on the most dangerous. And then we just got to kind of work through the rest. So for you, the list of most dangerous was a lot bigger of a list, even though not a lot of those were on the most likely list, right? Mm-hmm. And so we had to sort of, and some of them we addressed by just having a conversation about it or talking about how invasive it was. And then that teeny tiny rational part of your parenting says, okay, well, I don't want to poke and prod my current baby just for the sake of my own personal knowledge. And if it's framed in that right way, and we sort of come to the middle. I don't expect you to come all the way up to me, but I try and coax you up where you can or table things where we can, because also over time, a lot of this becomes a lot more manageable. Your own personal mental health gets better. Your sleeplessness improves. Your, the sort of hormonal side of early infanthood improves. And so sometimes if I can just put it off for a little while, we can have a more rational conversation later.
Yeah.
And I feel like for so many of us who've lost children, we've lost the confidence in ourselves as parents that we will know inherently, like my mom gut will kick in. I'll say when I found Aiden that morning, my mom gut did not kick in. I went to the bathroom. I weighed myself. I spoke to my friend on the phone. Like he was dead in the in his bassinet, and I was doing a million other things. There was no mom gut. So it's very easy to say, like, I don't know. I don't know how to do that. I don't have confidence that I can make everything okay as a parent. So how do you reassure a parent who has no confidence and they have proof on their side?
Yeah.
100% of my children have died. And at the time Judith saw you, 100% of her children had died. So that's like, that doesn't feel good. And you know, at the time that you were pregnant with your second child, like 100% of your kids had died. Like that is not good odds.
Nope. No.
And as many like statistics as you can see of like how rare it actually is, it doesn't feel rare when it's 100% of your own children.
You know, I had to keep telling myself that getting to the place where I felt confident enough to even fake it till I make it and was like a really big achievement. I think that the best advice I have, you have friends from before and you have friends from after, and every single relationship you have changes when you lose a child. Your relationship with yourself being what we're talking about right now, right? You're trusting yourself, your relationship with your partner, but like every single friend now doesn't know how to talk to you or doesn't know what you need or somehow makes it their own issue that they can't handle your grief. But I have a beautiful friend who was already my parenting, you know, blessed mother, who told me multiple times during this part of my journey and through the early days of Henry, that every child is different and you're never parenting the same child. And so every parenting journey, even if all of your children lived, you know, she has 3 healthy girls, and she's like, it's all different anyway. So your 100% is you 100% were the best parent that Remy could have. And now you have to 100% be Henry's best parent. And that's going to be a completely different parent. And that's going to be a completely different tool set. And that helped me sort of dismiss for myself some of those. And so I try and use similar lingo as much as possible of like, yeah, so you were batting whatever very bad is. Like whatever the, you know, score of 100% bad.
Batting 1,000. I know baseball.
Thank you. My father would be so disappointed. Right? But yeah, so it's okay because now you're going to play a whole new ballgame, right?
Yeah.
And you're not going to trust yourself, but this baby's going to trust you, and this baby's going to need you. And you really are just going to have to fake it till you make it. And that, like, there were so many, everyone's child loss experience is different. And so there are quite a few, you know, if you're talking about miscarriage versus stillbirth versus infant loss versus child loss, they all feel different. But within each of those categories, there's also how each person grieves. And so, you know, I know plenty of women who have had miscarriages early or late who just are sort of like, yep, well, it wasn't meant to be. And some that had like 8-week, barely knew the baby existed and are just completely traumatized, right? So it's all an individual experience already.
Right. And I can also, the circumstances of that loss, even if it's the exact same loss, like somebody who had, like, so for example, Judith and I both had babies die of SIDS. We both feel like there was nothing we could have done. Like the baby was on their back, like they didn't have anything in their crib. Like we really feel like I do think that to a certain extent, each of us has this kind of like, if it was going to happen, it was going to happen. Like, so we feel a little bit less of a semblance or an illusion of control over the situation. Whereas I can imagine if someone who had their baby die of SIDS, and even if it was fully SIDS, like doctors were like, yeah, it was SIDS. If there was a stuffed animal like a foot away in the crib, like I could see how somebody might approach it differently the next time and feel like different things might feel more and more traumatizing to them depending on the specific circumstances of the loss too.
Yeah. And so the guidance I would give those 2 different scenarios are completely different because, you know, and I mean, I think the last time I talked with you, Judith, we were talking about how that sense of control is a really big piece of it because, you know, sometimes you also have to look at the other parents in your grief community, you know, be them just peripheral context or whatever. I had doctor that I knew from training, who she and I were never close, and we both ended up in the cardiac ICU with our children at the same time.
Wow.
And just discussing, like, she knew through her whole pregnancy that there was something wrong, had to still deliver this baby, still go through a fairly similar journey to me, and still have it end up the way it did, was completely different for her than me, who blissfully ignorant thought everything was great until everything wasn't. And I'm really thankful that each step of the way, I never got given the whole story all at once. You know, as a pediatrician, had you told me when I was 20 weeks pregnant, had I done an ultrasound and they said, you know what, his left pulmonary artery is wrapped around his trachea, and his trachea is going to be 1.9 millimeters wide when he's born, and the likelihood that he's going to be able to breathe is like 0. And we'll do a surgery and hopefully everything will be great, but likely every single possible complication that could happen will happen. I never would have played this game, but I never would have met Remy, and I never would have been changed by Remy, and I wouldn't have the thousands of memories that I somehow magically have from 220 days that, you know, sometimes feel more poignant than the 3 times as long as I've had with his younger brother. So, you know,
Lena and I talk about that all the time. Remember when we spoke about that? You asked me, you're like, when my daughter.
Yes. So, I mean, you know, like, you reflect back, I am so glad that Remy was our first, because it meant I got to put all of my energy into him the whole time he was sick. And I got to grieve and take care of myself and take care of my husband. Because let's be honest, we have to take care of them too. and I had I didn't have the bandwidth, but like, I had better bandwidth than if I had other children. There are plenty of parents that the flip side of that coin is that, yes, you do not get to access your grief in a meaningful way. It takes 3 times as long, but you have something positive to sort of funnel your energy into.
Yeah, we do hear from people like, I thank God I have my other kids. They're like what's keeping me awake in the morning and all that stuff. And I think it kind of goes both ways, like you're saying.
Exactly. It's just the flip side of the coin. So, you know, but sometimes I have to be the one to say, like, you know, okay, your kids are doing great, but you're not doing great because you're putting so much of that energy into them. And, you know, if mama's not happy, nobody's happy is really like the big
reminds me
mantra.
Of that stupid questionnaire, the depression.
The Edinburgh.
Yes. That thing is horrible.
Is that the postpartum depressions?
Yeah.
It is. Yep.
It's
and it's
horrible.
like it's an internationally standardized, right? Because it's like from...
I'm sure maybe
it's horrible. Yeah.
It's horrible. I didn't even feel, I think at one point I just handed it to you blank. I was like, I'm not answering these questions because I can't answer them honestly. I mean, like,
I my honest answer was, I know the diagnosis.
Yeah, you said you're like, we talk openly about your mental health, so we don't have to worry about it. But I think I think it's interesting because that's just another example where, you know, you're doctoring the parent also. And I think it's also an example of how lost parents are different. I will pop up as a red flag on any time I take that stupid test. I will pop up with 5s all over the place, you know, like, my life is hard. I'm not always happy. I find joy, whatever it is. But I feel like if you're not a lost parent yourself, then you don't realize how unconcerning it is. My answers are not concerning. My answers are, if anything, reassuring that I'm aware. Yeah, my answers are normal.
We did an interview with Judith's therapist, and Judith's therapist said, like, I would be more concerned if you lost a child and you didn't feel that way. Like, that's actually honestly bizarre, right? If someone like loses a child and then they're just like, oh, I'm fine. It's like, no, you're not actually.
Yeah. But I mean, so the screening tools, because that's what they are, and not just for the Edinburgh for the postpartum depression, but like all of the mental health screening tools, they're meant to catch subtle people that might not share with their provider how they're feeling. And so it gives you a snapshot of what's going on at home. But like you're saying, like, I don't need a screening tool I'm very aware. I'm aware, and you're aware of what's going on. So really,
I'll say
really, it should just be, there should be like a deferral. No, what's amazing is Judith is not a mess when it comes to parenting.
Actually, I will say I've seen her firsthand mothering her daughter, and she is not a hot mess.
Nope.
But she is a hot mess as a person.
She's a hot mess for everything else. But
like I said, you put all your energy into so much, and then you have nothing left for everything else, right?
That was very generous of you to say. I think actually, I myself am surprised. I think there's a lot of reasons why I find that I'm not as anxious as I thought I would be. There are a lot of reasons. Something that Dr. Arling does with me a lot is points out how strong my daughter is. She points all the time, look, she's showing you she's healthy. She's showing you she's healthy. And I find myself and my husband also, like, even though we know she could drop dead at any moment, we have convinced ourselves, because she is physically strong, that she will not die. Like, I think that I've come to a point where I feel like all I can do is my absolute best. And she is showing me every day that she's strong, that she's capable, that she's on track. And I'm going to choose to find those things reassuring. Because the problem is not just, I left my daughter with my sister for a weekend a couple weeks ago.
Who, again,
my sister
is a pediatrician.
right, whatever. I only have one sister. So she asked me, like, she was like, what is her schedule? And I looked at her like she was bananas. I was like, I don't know. Like, she eats in the morning. She naps, whatever. I could give you a schedule if you really want one. I was like, I don't care about the schedule. I was like, here's what I'm worried about. I'm worried that she is going to catch RSV and die, because I know a baby who did that. I'm worried she's going to catch pneumonia and die, because I know a baby who died like that. I know a baby who died swallowing rocks. So I'm worried about her with rocks. I'm worried about her with blinds and those strings that hang from the blinds, because I know a baby who's died of that. I don't care about the little things, because I know there are 25 million ways to die. And I think as a parent, you've told me that's kind of normal, that you'll be worried that your child will die in a million ways, but it's also not. I think it's both. I think it's the specificity to which I know I'm no longer worried about SIDS, but it's I'm worried about all these other ways to die. Mm-hmm. And I know a whole lot of creative ones. And I think that's both every parent worries their child will die and get hurt. And also I'm acutely aware of how horrific it is. It's both. I hold both.
Yeah. Yeah. You feel it in a different way.
Yeah.
Yeah.
Can I ask, so Judith and I feel genuinely, fully, I live in the land of dead babies. All the babies I know are dead, because a lot of my friends, most of my friends do not have kids. Judith's baby is one of the only 2 babies that are really in my orbit at all. I live in the land of dead babies. We are on dead baby Instagram, as we lovingly call it. It's just all dead babies all the time. Okay. We see someone who's pregnant with a baby. We're like, oh my God, I hope that baby's born alive. And then they're born alive. And we're like, oh my God, I hope that baby makes it until their first year. Every baby, I'm just waiting for them to die. You see babies all day, every day, and most of them don't die. Does that help? Right. Should I go back to school and become a pediatrician?
Yes. Or maybe just maybe there's a shorter way to do it. Maybe you just come be a medical assistant in my office, which takes a lot less training.
That's fair.
But yeah, it is really helpful to see just how resilient they are. And my day to day, one of the ways that I didn't realize that was happening, because, it's just my world, right? It's and I, up until the pandemic, when they kicked us out, I would actually go to deliveries and do stuff with the hospital. Mm-hmm. And so I was in the hospital once a week, just seeing brand new, healthy, well babies. Yeah. And when we finally got around to having Henry, we had a lovely nurse who was actually a grief counselor and connected. I got services through a local hospice community for some psychological services for a period of time, which was just so nice to not have to worry about the finances of all that and the logistics of all of it. It was just sort of handed to me. One of the benefits of having 12 pediatricians as good friends who just needed something to do was they found me psych access, but they got me plugged in, and they're like, you have to come and tour the new hospital. It's not the hospital I delivered Remy at. It's not the hospital I deliver babies at. It's a different hospital. You need to come and look at it and pretend you're a new mom that doesn't know. I'm like, no, I'm medical. I don't need that. She's like, no, you need to come and you need to bring your husband and you need to park the car and carry a pillow and walk into L&D and sign in and get a tour. And I was like, okay. And we're walking in and I'm like, okay, it's a hospital. No big deal. No big deal. My husband, who's also a doctor, started hyperventilating in the waiting room because it was the first time he had been in a hospital because he doesn't deliver babies since Remy died.
Yeah.
And so she was 100% right. She was just wrong about which one of us because I was fine. But like, but that's when I was like, why am I not freaking out? Like he is literally having a panic attack. He was Judith in the first time I met her on the floor, but in the middle of a hospital waiting room. And it was because this is my day to day. Right. Like I do get to blend out like that negative of my own experience with the positive everyone else's.
Does that feel even lonelier because you're the only one?
Yeah. And maybe that is why, despite it being, cathartic, but also emotionally draining to help my traumatized families, why I value it because it also gives me a sense of community because
Can I ask you how it feels? Because I'm assuming most of your patients are not dead baby families. I don't know what bereaved families.
Yes, most, are not.
Can I ask you, how does it feel when these non-traumatized families are really acutely worried about something that's like really not going to happen? Like somebody's like, oh, my baby's breathing weird. And you're like, no, they're breathing normal. And like, I know what it's like when a baby's breathing weird. Cause like my baby breathed weird and he died. Like, how does that feel? Like, how do you deal with that?
Yeah. I think that was really, really hard for me in the beginning.
Yeah.
And, there was a lot of like resentful moments of like, oh my God, they will not shut up for a half an hour about a diaper rash. And and the worst thing that would happen with this diaper rash is that we have to put a cream on it, right? Like there's no life-threatening thing ever happened from a diaper rash. And my husband had his own grief journey. He was the one that he is actually more of the empath of us as physicians. And he's like, you just have to tell yourself that this is the hardest thing they've had to go through. And they have that same worry about their baby that you had about your baby when your baby's trach tube pulled out and they weren't able to breathe and we had to put it back in ourselves. And it was really scary. Yeah. For them, this diaper rash is that it's the hardest thing they've had to do. Yeah. And I still, on a very regular basis, have to like think that in my head. I'm like, okay, this is the hardest thing they have had to go through. And I'm a lot, it comes a lot more naturally to kind of give that empathy back again than it in the beginning. I think I just probably was a little bit of a robot about it. Okay, well, we're just going to put the cream on. Yeah. Now I can understand.
What do you do? This is a question Alina and I have also wrestled with. When you hear that somebody is making risky choices.
Ooh, good question.
Like almost too much naivete. Yep. I've had people knowing my situation, like say, oh, we sleep with the baby in the bed. And it's like, I don't know. I wrestle with how to respond. But you are a doctor. So like, how do you respond? I can walk away. You can't.
Yes. Yeah. So
we can say like, not my horse, not my whatever rodeo.
Yeah.
You can't say that, right? It is your rodeo. That's not the right phrase.
Yeah.
But you know what I'm saying?
Yeah. Before I became a parent, my way of giving advice was being like, well, the AAP guidance is blah, 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 blah. Mm-hmm. And now, whether it's because I am a parent or because I have had much more experience as a pediatrician, most of the time my advice has to do with situation. So if somebody's sleeping with their baby in a DockATot, I tell them, I'm like, okay, I have a friend I went to residency with who went to a conference. So she's a full-fledged pediatrician. She went to a conference and her husband left the baby in the DockATot and the baby's not alive now. And you don't want to be that family or that parent, right? Like I end up using a lot more. I use my own experience plenty, either my experience as a pediatrician of like, I've had to handle a baby that something or other happened to. And
do you disclose to your patients that your child died always or not always? You do always disclose?
most of my patients know through different ways.
Yeah.
I did a Washington Post article after Remy died about breast milk donation. And it was pretty open about what had happened. We run a 5K for children's every year. And we have a team in his honor. So some people just know kind of peripherally. And also since my husband and I practice together, like it means the same group of people have just as, if they haven't heard it from me, they've heard it from him. But I do, if I'm seeing a brand new family and they say, how many kids do you have? I always say 3. And then I know I'm walking myself into a trap because then they're like, oh, how old are they?
Yeah.
And I'm like, well, and then it's like, okay, how
do
much
they
of a
respond?
conversation?
Just curiosity, like how do patients respond?
For the longest period of time, especially when he first died and all of them knew I was pregnant and all of them knew that I was like in and out because I still worked through those 8 months, but I didn't do as full time, but I was still in the office. So at that point when they're like, oh, and how's the baby? And I'm like, the baby died. They would cry and then I'd feel guilty.
Yeah.
And then I'd feel resentful that they were making me feel guilty. And there's a lot less of that now. Now it's just like, all right, I'm walking into this trap.
I can.
And then they say, I'm so sorry.
Yep. And I'm just like, okay. And when did the fever start? Like, I just like change the situation. I recently, but most of the part, I'll talk about it. No problem. I felt a little bad because I actually have a family that was having cardiac problems and their child's doing lovely, but has a cardiac history. Right. And they're not my primary patient. They see one of the other doctors. And we sort of I was seeing the kid for something routine. And somehow it came up that I knew the cardiologist that they see. Oh, well, why? And then I was like, oh God, this is getting bad. Because then you're worried, like, I don't want to make this cardiac family yet again have to think about how their baby could die.
That happens to me all
because
the time.
Of me. So then I was trying my hardest to reel it back in and get out of that. And I couldn't.
When I talk to people who I know who are pregnant with their first, and then, that I mentioned that I had a son who passed away, and they're like, how did he die? And I'm like, I'm happy to tell you, but like, pregnant, you're going to be a new mom. Like, why? Like, because I know the minute I tell them, like, their face is going to be like horrified, and then they're not going to sleep for months. And so I always end up saying, like, he died, but your baby's not going to die. Like, just he died. It's really rare. And I'm like sitting there, like, telling this person like 25 times, you're going to be fine. But I don't know if you're going to be fine.
Can I ask? So this is our podcast. Obviously, the vast majority of our listeners are lost parents themselves, but I would say most of those lost parents are not SIDS parents, and we get questions a lot. And this is not something we aren't like experts on SIDS. We just happen. I mean, we're experts on SIDS in a way I wish I was not, but like we don't know the guidelines and all of that stuff. Could you give like just a quick 1 minute? Even just today, this morning, somebody was like, I'm really worried about SIDS, and like we are not the experts on that. You are. Can you give us like 30 seconds on how to prevent SIDS so I can direct people to this episode in addition to the ones we've done with other SIDS people? That would be great.
Sure.
For our stillbirth and our TFMR and our miscarriage parents who are anxious about a whole other way for babies to die.
Yeah. Well, I think all of us, we're looking for the things we can control, right?
Yeah.
So I cannot control the neurologic development of your baby, the prematurity of your baby, the cardiac health of your baby. But the things you can control are you can always sleep them on their back. You can make sure that there is nothing in their sleep environment that they could roll into, even by accident. Make sure that the mattress is unfortunately rock hard. So like an actual AAP, a certified bassinet, preferred now with the mesh sides, but so some of the older stuff actually isn't meeting full criteria for being approved. They used to say that it was okay to, as long as there was a tucked blanket and it was below nipple line, that's safe. But really at this point, we've said it's not worth it. Just dress the baby warmer or use a swaddle. Make sure you're using the swaddle appropriately. If you don't feel comfortable with how the swaddle is wrapping, because every single baby is different in their shape and their proportions. If you don't feel like they have that nice V of like open airway, then don't use it. Pick a different one. Wait till the baby grows. Just put the baby in something warm, dress them in a warmer pajama and call it a day. And I almost always recommend the like Velcro-y zippy things over the just like blankets, unless you're, an origami expert.
Unless you're like a labor and delivery nurse, because wow, can they really burrito a baby?
Yeah. And my skills have been lost, because when I was in the hospital on a regular basis, I could do it, but like nobody uses them at home. I didn't use them in my own kids, but none of the weighted ones, right? Just the suck them in ones. Yeah. Pacifiers are actually protective. So it keeps the tongue up and out of the airway. So if they want to use that, it's totally safe, but it doesn't mean you have to. Smoking is actually a very big deterrent. It causes airway irritation and swelling, either being too cold or too hot. So we recommend keeping a house between 68 and 72 degrees, or at least that the room temperature should be between that, and the babies should be dressed in whatever you would wear in that temperature plus a layer. So that swaddle typically being the layer. They need to have good airflow within the room, but not directly on the baby, so having something circulating like a fan or, but you don't want breeze on them. Hats are not recommended anymore. They keep a baby's head warm, but they're also a suffocation risk. And so are the little mitten things. So use flip cuffs, or if the baby's hands are tucked in, they don't really need anything anyway. And just wear warmer clothing instead of putting a hat. Those things are fine when you're awake, but not when you're going to be unattended. Yeah. Okay. And then what we call co-rooming for the first year of life, which if you don't have access to crazy monitoring systems, is in the room. But at least audio, and close being able to
and
run to them.
Co-rooming, I just want to be like super clear. Co-rooming and co-sleeping.
Very different.
Co-sleeping.
Very different.
Same bed. No. Co-rooming. No. Same room.
Yeah.
Yes.
Yep. Yes. Okay. And we, I mean, from a pediatrician standpoint, I want that baby in a completely different sleep space than you. And sticking a DockATot between you two in the bed doesn't count. Having the co-sleepers that are off to the side really can kind of be problematic, because even if you don't get into the co-sleeper, your comforter could get into the co-sleeper. So I want the baby in a completely separate space. And I'd rather that be a portable pack and play where you unfortunately have to break your back bending over and getting up and down and in if you can't get the bassinet, than something that's super convenient. I trained in Baltimore, which actually has a really high SIDS rate, and they were giving out boxes that were the size of a traditional bassinet that inside had a whole bunch of baby clothes, and you were actually just supposed to put the baby in the box, because it was safer than anything else
a lot of
they were
cases?
doing. A lot. Yep.
Wow.
I have had to do CPR on more than one baby with SIDS who
None of
was
them
not alive anymore, but that parent really needed me to try.
Yeah, we've been there.
So,
each of us has
we've been there.
Yep.
It's not good.
So
when I gave birth to my daughter, they gave me that spiel at the hospital, and I was just like, lady, I could give you that spiel, and I could do it better. Don't even start.
Yep. But even all of that doesn't
but they have to. They have to do it, and I think it's good that they do it.
Thank you for that. I'm sure our listeners will appreciate that. Our anxious parent listeners.
Okay. I know we're at time, but I want to actually ask one more question, which is that I think I am very lucky that I found you, but not every parent, most, because I think I'm the only one of our listeners that do get to go to you. So most people are going to be going to
that I know of.
Yeah, but I don't know. I think most people are going to be going to pediatricians that are not necessarily lost parents themselves. So 2 questions. What advice would you give to a parent who is going, to another pediatrician? How can they articulate their needs better to the pediatrician so they can, service them better? And then the second question is, what advice would you give to other doctors to meet the needs of their patients?
So I think if you're a bereaved parent and you're trying to seek access either with your current care providers or a new care provider, it's as much of your story as you feel comfortable sharing, the better. And if you don't feel comfortable sharing that in person, and if it could be like you write things out or you get access to all of your child's medical records so that they can look. Now, of course, like that's not your child. What it says on paper is not nearly as helpful as what your experience has been. Sharing your own mental health journey, which lots of parents, regardless of cause, really don't want to talk about their own mental health journey when it comes to talking to the pediatrician. But not only is that important because you're raising your child, but it's also a lot of those things, your child might be genetically predisposed to given their own trauma and life burden in the future, right? So it's both a direct and indirect assistive. I think, if you identify yourself as, and I think some of the reason for some of the terms like rainbow babies, so that like you can give a snapshot to somebody that like, it doesn't matter how you lost your baby. If this is your rainbow baby, you're now putting 2 babies worth of love into this one baby. And the providers who are taking care of your child need to give twice as much care to this rainbow baby in honor of your other child. And so even just some of that terminology, though everybody has a different opinion about how they feel about that terminology, but like anything that can kind of help them understand what's going on, no matter how painful, can really kind of help you feel like you're getting a better experience.
And if they're not matching that, can they just go somewhere else? Right?
Absolutely.
Like, yeah.
I think it's also the people who are uncomfortable with it, be it because of their own journey or just from lack of experience, I think would 100% not mind you saying like, is there somebody in your practice who might be better, equipped to help me handle this. Yeah. Right. And that's not that. If it's not this, it's like, okay, well, if your, pediatrician didn't really seem to be doing great with your asthmatic kid, you'd feel no problem in saying like, all right, which of your partners knows asthma better than you do? Cause you're pretty crummy at this. So it's the same thing. Like you kind of have to be willing to shop around to find somebody who has a good personality fit and a good sort of repertoire and understanding of sort of the medical behind it. For the providers, and I use the word providers because we have some amazing PAs and nurse practitioners and sort of, there's technically different types of doctors, there's DOs and MDs. And, so whoever you get the best value of care from, that's who you should see. And if ever their medical acumen is not everything you need it to be, there's no reason you can't go, like even for me, it's like, okay, well, let's send you to the cardiologist or the neurologist if you're worried about sort of these higher level issues, because I don't have the answers to everything. I just know where to find them or who to find them with. I'm sort of as the pediatrician, you're the generalist. I'm the person sort of responsible for keeping all pieces of the puzzle and thinking about the whole family unit, the whole kid, and so this is, though it's a huge piece to you, it's a facet of the whole thing that I'm kind of having to keep in mind. I think ultimately you have to find somebody who inherently has the personality trait of being empathetic enough to be able to say, like, I have absolutely no clue what's going on, but I'm going to try and support you through this. And I'm going to at least try my hardest to give you what you need. But it is going to be harder in that person doesn't know inherently what you need. And, I don't know what every person needs to grieve. I beat my head against a wall for a really long time trying to get my husband to talk about all of this, because that's how I grieve, is I, vocalize, and took a long, long time to figure out that just wasn't going to happen. And so my father had died when I was young, when I was 20. And so I also thought that I knew grief. I knew what this was. my favorite person in the whole wide world died when I was 20. It couldn't possibly have been worse. And losing my actual favorite person again. Sorry, my husband keeps moving down the list of people. But, yeah, it was completely different. For me, with each of those grief situations. But each time I'm like, oh, I've got this. I know what's going on. That's not true, right? If Tim died tomorrow, I'd have a whole new version of grief. So let's not. And
at some point, maybe, though, I feel like we could just say you have a PhD in grief. At some point, I feel like we could say you win the biggest bummer award.
I actually did, for the record, just win the bummer award at a podcast taping because my life is so bad that the audience voted that I won the bummer award.
But I mean, you're so good at grief.
That's like that's the senior superlative that nobody wants, right? It's the yearbook thing that's like, oh, best smile, cool. So nobody thinks I have any substance. So I got but yeah. So I think you need somebody who realizes that each experience is different.
Yeah.
You need somebody like my friend who could say, it doesn't matter because it's going to be new and fresh and different this time, so that they can at least be malleable enough and kind of roll with you on this new journey that you're now having to go on, even if they don't know everything that's going to happen and you have absolutely no clue what's going to happen.
Yeah.
Because if they're really rigid, it's not going to work.
But I also think it's one of those things that I'm not sure if you could ever teach it to the level that someone who's been through it can get on the floor. That's what I'll say. There's some things that just maybe can't be taught. Maybe the advice I have for other pediatricians is be malleable, meet them where they are, and also respect the fact that you'll never understand and you're lucky. Well, that was a sad note to end it on. But...
I think those were all of our
I think it was poignant, right? I think, it hits home that we are members of the club that nobody wants to be in.
Yeah.
So,
well, thank you so much, Dr. Arling,
for
coming on, and thank you for taking such good care of Judith and her daughter.
To all of our wonderful new friends, we want to hear from you. Email us at aslongasimlivingpodcast@gmail.com and follow us on Instagram at aslongasimlivingpodcast. We'll get back to you as soon as our grieving brains allow.